MMT, shoulder horizontal abduction, posterior deltoid. Assist the patient to the prone position with the shoulder abducted to 90 degrees and the forearm off the edge of the table with the elbow flexed to 90 degrees. Stand behind the patient on the test side. Passively horizontally abduct the patient's shoulder. Support the arm by placing your hand under the elbow joint. You are not assessing the end feel. You are determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to horizontally abduct the shoulder. Stabilize the patient across the patient's back. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the triceps by extending the elbow and the arm coming out of the plane of horizontal abduction. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient across the back. Your other hand is contoured over the arm just proximal to the elbow joint. The resistance is applied in a downward direction toward the floor. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in shoulder horizontal abduction and holds against maximal resistance. Grade 4, good. The patient completes full range of motion in shoulder horizontal abduction and holds against moderate to strong resistance. Grade 3, fair. The patient completes full range of motion in shoulder horizontal abduction but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Position the patient sitting in a chair. Allow the patient's arm to rest on a surface, such as an adjustable table, so that the shoulder is abducted to 90 degrees with the elbow partially flexed. Stand behind the patient. Stabilize by placing one hand over the superior aspect of the test shoulder. Grade 2, poor. The patient completes full range of motion of shoulder horizontal abduction with the arm supported. For grade 1, palpate the fibers of the posterior deltoid below and lateral to the spine of the scapula and on the posterior aspect of the proximal arm next to the axilla. You will need to stabilize as you position your hands for palpation of the muscles. Instruct the patient to try to horizontally abduct. Grade 1, trace. Palpable contractile activity of the posterior deltoid with no motion. Grade 0, no palpable contraction.